There's a massive shortage of healthcare providers to run the healthcare system. Many, like myself, burned out and left the profession. While there are efforts to recruit out of country healthcare providers, this eventually has a limitation too. What we really need to fix the system is to get patients more involved in their healthcare. Most of the health problems today are chronic disease, not acute disease. But the system was designed for acute disease. In the healthcare system, we often treat patients as passive recipients of care. This is a big problem because most of the chronic disease management is done outside of the hospital setting. We need a much bigger buy in from patients. They're the ones doing most of the work. If we got patients more involved, this would add necessary batteries to the healthcare system. Here's an example. A family physician sends off a cardiac referral for one of her patients. She has sent over 90 referrals in the last month. One of those might get missed because she's monitoring all the referrals. What if the patient was responsible for booking their own cardiac appointment? The healthcare provider could still assess and decide if cardiac care was needed, but the referral would be the patient's responsibility. If you're a healthcare provider, you might be getting a little twitchy at this idea. What if they can't book an appointment? What if they get confused? Oh, but we're going to give them a chronic disease management prescription that involves taking 5 different medications. Why are we shocked that they don't follow through? We've been treating them like passive recipients and dependent the entire time. If the patient can't put in the effort to book an appointment, then they're not going to do all the recommendations asked of them at that appointment. You could have navigators to help those who are truly lost or confused. And yes, it would require teaching patients to take on a whole new way of being in the healthcare system. But this would truly solve the human resource problem in healthcare. And the patients should have been involved to begin with. That's essential in chronic disease management. We need their buy in.